39 weeks pregnant. What to expect. This week may well be your last week of pregnancy, and your baby is ready to join you in the world. Find out what's happening to you and your baby at 39 weeks pregnant. How big is my baby at 39 weeks? Your baby is the size of a small pumpkin and is now officially full term. Your baby will now weigh between 7 and 8 pounds and measure between 19 and 21 inches from top to toe. She won't grow much more now, but her brain is still growing at a rapid pace that will continue for the first 3 years of her life. What's my baby doing at 39 weeks? This might be your final week of pregnancy, but babies usually go past their due date. Only 4% are born on time. So don't expect a prompt arrival, especially if this is your first child. You won't be allowed to go past 10 to 14 days overdue. You'll be offered an induction. Once your baby is born, you might be dreading the crying in the middle of the night, but have a look at your baby's face when she lets out that first beautiful sob. Because your baby's tear ducts won't be quite ready to work for about a month after birth, those first few weeks of midnight wailing won't be accompanied by any tiny tears. Your baby is also perfectly squeezable in preparation for lots of cuddles. A thick fat layer has been deposited over her blood vessels, making her body extra huggable. This fat layer will also help to control her body temperature after birth. What is my body doing at 39 weeks? Your body will be going through plenty of changes to prepare for labor, but here are some of the signs that you're going through real labor and not Braxton Hicks. Strong, regular contractions that last more than 30 seconds and increase in frequency. Established labor is when your cervix is dilated by more than 3 centimeters. A bloody show in which the jelly-esque pink-looking mucus plug comes away either fully or gradually. Not all women have this, though. Your waters might break. If your waters break before contractions start, then you should also phone your midwife, doctor, or hospital immediately. Backache and strong regular contractions. Diarrhea, especially if accompanied by contractions. You should be visiting the doctor weekly at this stage, and during your appointments, your doctor will be checking your stomach to look at your baby's growth and development. If you don't go into labor on your own, your labor will usually be induced between 1 to 2 weeks overdue, or even sooner if they deem the risk of waiting greater than the risk of delivering your baby immediately. 39 weeks pregnant symptoms. 1. Braxton Hicks contractions. If you've been experiencing these practice contractions, they may be getting stronger now. But if you haven't had one yet, don't worry. Braxton Hicks contractions are more common in second and subsequent pregnancies. 2. Backaches. Your backaches could be worse now as you count down the final weeks. You can soothe a sore back by getting into the shower and letting the warm water pulse onto the tender spots. 3. Mucus plug. This week, your mucus plug may fall out, though you may not notice it. Losing it isn't a sign that childbirth is hours away, but it does mean it's around the corner. Thanks for watching. Subscribe to our channel for health updates.